Hi guys, my name is Dr. Kavita, and today we have an amazing guest, Dr. Brinda. So she has an amazing journey, and she's currently a neurology resident and also an amazing USMLE STEPS tutor. So we will know more about her from herself. So I will also start with the basic questions about her journey, but this video we will focus morely about like USMLE Step 2 journey and what resources should we use and what is the timeline for Step 2. So, hi Brinda, how are you?
Hi, Kavita. Thank you so much for that warm, lovely introduction.
So I want to know like for a person who knows nothing about USMLE and is really scared. So in just the beginning, what's one thing that you would want to say? And if you look back at yourself, few years back, so what was one thing that you were really scared of, but it wasn't a big deal?
I think when you just started saying that one person who is very scared of, I could totally see myself 5 years back. One thing that I would say to someone like that would be that I know it is going to be super overwhelming with so much of information out there nowadays, so much uncertainty and everything. But I feel that if you have the right action plan and if you have that mindset to go all in, you are going to make it. Once you lay the plan out, it is
Mhm.
very much doable. But beforehand, when you are just kind of juggling and getting all this information from everywhere, it is gonna sound like it is gonna look more overwhelming and
Yeah.
difficult. But
Yeah.
I promise it's just gonna get easier with time.
No, like you said, like there's too much of information, and trust me, like nowadays, like everybody has so much to say about, one thing, and there are like million ways to do it. But it gets overwhelming when we don't know what's the best way for us. So I think, yeah, like you said, like planning is one thing that one can focus on, like while beginning their journey. So regarding step two, I mean, yeah, we have like so many things that we can talk about in the further videos. But in this video, so first I would like to talk about few things related to step 2 CK. So first question for you is how long did you prepare for step 2 CK? Because for one or the other reason, people are obsessed about like the number of months.
Number. Right. I think it is very personalized. That having said that, I took around 5 to 6 months. Not very proud of it. I think that was a mistake on my end, but I finished it in around 5 to 6 months.
5 to 6 months, which is, I think, not a bad timeline, I would say, like for
Yeah.
an exam, because sometimes we put too much pressure on us. So it is also, like you said, like it's different for everyone. But just to, kind of compare like our journey with anyone else, and then the journey can differ if somebody is doing a job or doing a rotation, or, even like I've heard so many people like in USMLE, some people like actually get married and they're like moms giving birth. So it is difficult for, everyone regarding their situation. But okay. So what resources did you use and which ones were you like, did you find like most helpful?
So the primary resources that I used were UWorld. For certain systems, I did use first aid, like for him and onc, for endocrine, for neurology. Lot of I feel the content for step two was based on the step one first aid. So for certain systems, I definitely went back and forth from first aid and then adding
Mhm.
the step two new stuff in my first aid for those particular systems. Otherwise, I think I was primarily referring to UWorld notes and
Okay.
UWorld. Later
Okay.
on, like once I was done with the two passes of UWorld, then I did Amboss for certain systems, especially ethics and biostat, like my
Mhm.
weaker systems. I wanted to keep exploring more and more MCQs and just get better at the systems that I was weak at. So I went for Amboss in those.
Got it. And any podcast or any YouTube channels?
Yes, I actually heard like I used divine intervention for
Mhm.
couple of things. I'm not very sure whether, like, I don't remember what exactly those topics were, but one thing definitely stuck to me was the antibiotics podcast. I think that
Mhm.
was amazing. Like, I was too good.
Oh, nice. Okay.
I heard it last minute as well, and very, very helpful.
Okay. And just to put it out here, some people also have like kind of notes, or even in Discord or even on Reddit, you can find which podcast to refer to, because there are obviously some podcasts that are more important and you don't need to listen to all of them. So that is the one thing. And you said like it's step one first aid. So just to point it out, it's not the step two, but the step one first aid. So it's kind of a revision in that sense. So that is good. Okay. So this is one thing which I also personally want to know, like what was your daily or weekly like study routine for whole of the preparation? And did it change like in the, intensive phase?
Yes, it just first answering the last thing was that it did change in the intensive phase. When I said it earlier that I'm not very proud that I finished it in 5 or 6 months, and I think I agree with you when you said that every person's journey is so different. So if I just say that I finished in 5 to 6 months, people will be like, okay, this is so much doable in 5, 6 months. But I
Right.
was doing it with US clinical rotations. So
Mm,
I feel that like I don't recommend people doing both at a time. I feel if you should start with step two, at least get a grip of it, and then do rotation so that at least you can do justice to both the things.
mhm.
While preparing for step two, I just stepped into the US. So like my first rotation, so I was like trying to give 100% over there, trying to study coming back home. So in initial 4 months, my study schedule did not look very nice because I was at the hospital, coming back home, studying for around 4 or 5 hours that I could. I think one thing that changed drastically in the final phase of my preparation was that that was the time when I actually found my like community and started tutoring for USMLE step 2. I always needed a study partner. So in the first
Mhm.
4 months when I was trying to be consistent along with the rotations, I always had a study partner. But somehow I faced kind of inconsistency with the study partners as well. Sometimes, the vibe doesn't match, and maybe the other person is not at that level where you
Right.
are. Like
Mhm.
they don't want to give the exam that early, stuff
Right.
like that. So in the final stage where I felt like I'm almost there, that's when I created this little community where I started tutoring for step two. That was my first batch of like 10 students. And I decided that let me complete the entire course in 30 days because that's what I wanted to do for myself.
Mhm.
We completed the course. It was great because now my way of learning was through teaching. So my
Right.
final phase of preparation for step two was, I think, the best one out of the entire
Right.
5 6 and the most productive one, I would say, because
Mhm.
now I
Mhm.
was 100% focused. In the final 1 month, I did not do the rotation. I just studied for the exam and went for it.
Oh, that's nice. Okay. Yeah, there are so many good points that you said. First of all, about the study partner. So I just wanted to say, study partners can also be such a blessing if you find the right one. So in my step one journey, I found one and she motivated me to book my exam. And even when I was tired after coming from hospital, but since, we had that accountability, so we would study for 4, 5 hours and sometimes even do 100 to 115 question, which was like crazy. I don't even believe it if I was able to do that for a certain period of time. So yeah, finding study partner can be tricky, but it's good if like someone puts effort in that side and they can find one. And second thing is like teaching is like the best learning. So even I tried that, and for the difficult topics I would also like try to teach each other in our study group, and that helped us. And if you can kind of take your preparation through a tutor, and you can decrease your number of days that you're preparing for. So I think in USMLE, I also found out that that could be the best way to kind of enhance your preparation style. So yeah, that's amazing.
Just wanted to add that I feel consistency is the key. So whatever helps you stay consistent, whether you can just study alone, study with somebody, need a community, just go for it.
Yeah, that is so true because I mean, especially with me, with my job, it became difficult to study every single day. But having something to kind of, put you back in the track, be it the study partner or the tutor, so that is really important. So yeah, thank you for bringing that point. So next question is, how did your step one experience kind of, influence your step two preparation?
I think a lot. My entire perspective for not just USMLE, but for medicine changed after giving step one. I think there is so much in depth knowledge and so much learning that goes while you are studying for step one. And I started preparing for step two right after the step one exam. I was quite lost during step one. I took like a very long time to give my step one. Like I said, a lot of uncertainty, overwhelming, not knowing what resources to use and everything during step one. But in step two, I had some amount of clarity, and that is one of the major reasons why I referred back to step one first aid
Mhm.
while studying for step two. So when I was studying for step one, I like my FA. I wish I had it here, but in my FA, I have broken it down into three parts with inserting like one page
Right.
after every other page, and like a very
Same.
detailed,
Yeah, yeah, yeah.
yeah, broken down, and like solidifying the base kind of
Right.
work in the
Yeah.
FA. So for
Mhm.
step two, I felt more confident, even though I did not know much, but I still felt more confident that okay, my base is more clear, so
Right,
I'm gonna
right.
do better in step
Hmm.
two.
Hmm.
So, like I said, like couple of systems I studied from step one FA
Hmm.
that were very useful, and that's
Hmm.
why I recommend people to start studying for step two as soon as you are done with step one. Similarly for
Okay.
step three, like
Okay.
use step
Like,
two
yeah,
as the ladder.
got it. Okay. Now talking about the resources, can you share more, like in detail about how you planned your U world, like number of question, what was your strategy while, attempting each questions?
To me, I feel everything in life, whether studying or anything, it is all about gaining that confidence. So, whatever strategy works for you to make you feel that, I am good with this now, this is sorted for me, go ahead with that. Something that worked for me to build my confidence was to do it system wise. Like, I want to break down each system, I want to make notes, I want to understand just for my mental peace that, okay, now I'm done with this system. I think like I'm good with it. So, the first pass of UWorld I did with breaking down the systems, like doing one block of UWorld, starting with 40 MCQs, then bringing up to like 80 MCQs, um, and doing it system wise the first time. Also doing it in the timer mode, or not the tutor mode, the time mode,
Okay,
where
the time
doing,
mode. Okay.
yeah, from the beginning.
Hmm.
Because like I said, I was just planning to give it in 4 or 5 months, because I was desperate to apply that year for the match, so I did not have much time. Also, I started preparing in, I don't know, January or something, and yeah, gave it in around June, July. But
Okay.
yeah, so I started preparing in time mode, 40 to 80 MCQs in the initial phase, and then spending more hour, like if 1 hour solving it, 1 hour solving the MCQs, and next 2 hours to make notes, understand each and every concept from the U World printed notes,
Mhm.
and kind of adding my stuff to those notes.
Got it. So did you add your notes in the U World notebook or separately, like handwritten notes?
So I printed out the U World. I'm not sure whether that's still out there, but there was a U World PDF
Hmm.
that had all the notes from the U World,
Oh,
all
right,
the
right.
answers. Yeah. So I
Hmm.
printed that out, and then similarly with how I did with FA, I inserted one empty page after each of those
Hmm.
pages, and then
Hmm.
kind of added my points, or like how I should think, how I got this question right, and how should I have gone for the answer, stuff like that. just like small in my language.
Okay, okay, got it. So, yes, so either we can print it out, or if somebody's reading like in an iPad, so they can just, use the PDF and then add their
Right.
notes. So this U World note, like notebooks or answers are like circulated in various Telegram groups, so you can refer for those notes from there. And regarding NB and ME, like, did you start giving it after finishing your U World, or did you start it in between? Like, what was the strategy for each NBME practice test?
I think for both step one and step two, I went for NBMEs much later on in the phase. After
Mm-hmm.
at least I was done with the first pass of U World. Yeah, as soon as I was again like first pass of U World, then I used to take time every weekend to solve the wrong answers from the first pass. I like the weaker systems, especially biostats. I was terrible at biostats. So every
Hmm.
weekend, just taking up 10 questions and solving them along the way. Then
Okay,
during the second pass, when I started scoring like 75, 80% in the U World consistently, that's when I started preparing, like going for the NBMEs.
got it. Okay. So, like first finishing the U World and then starting the NBMEs.
Yeah, that's what I did.
Okay, great. So when like did you plan your NVMEs like together? Like are you gonna take them like in every 15 days, or like did you just follow random like timeline for NVMEs?
I would say I rushed into it, because
Okay.
then I did not have much time. I
Hmm.
definitely wanted to give the exam before the application cycle to get the scores. So then I was just giving it every week, or,
Hmm.
like 3 to 4 days.
Got it. So what we know till now is that you started, and that's like what you would recommend is starting like system wise and working also on the kind of speed. So doing it in a time mode and then reading each explanation. And if you get stuck, then kind of reviewing it from the other resources and or making notes and kind of noting down what concept helped you in answering the question, right? Okay, so I think mostly we have talked about the resources, but any other supplemental resource that you like, can think of your mind, like from YouTube, like or any Enki decks, anything like that.
I think I definitely referred to one more video from, I think it was Randy Neal's videos
Oh,
for
right, right,
biostat.
right. Yeah,
Yeah.
even for step one, I was that.
Okay. Yeah. So, like I said, for
Okay.
for biostat and ethics, I just went all in. I was looking for as many
Mhm.
resources as I could, because like I did
Right, right.
biostats.
Okay, got it. So now talking about the test day experience, like what's the testing experience like? And did you give your exam in US or India? And how did you manage your time during the exam?
First things first, I'm a terrible test taker.
Aren't we all are?
I've seen my husband. He's not one of us then. Plus, when you have somebody in the room who is like, completing all the blocks way ahead of time, that
Right.
adds extra pressure. So,
Yeah.
um, yeah. But anyways, how I managed was, I like to take small like breaks after every block. That
Hmm.
is kind of my style. I like to take a quick walk, 2 3 minutes, have a sip of water, something to eat, just to get a refresh, energy and mindset. Like even if the
Hmm.
block went bad, then I want to walk out of the room, change the mindset, and then when I walk back in, I'm like, okay, this is going to be a different thing. If it was like a great block, like you think that you knew everything, then also you don't want it to get to your head, so you want to walk off,
Mm.
just kind of, re-energize a different kind of thought process. Then you want to, that's how I did, like 2 3 affirmations and then walking back in.
Nice. Yeah.
So yeah,
I
short
think that I,
breaks.
I did the similar technique in step one.
Yeah.
Especially like if you look at the time, so you don't get more than 10 minutes per block, for the break. So like munching something, you also don't want to kind of overload your brain, with
Yeah.
glucose. So it's like like what most people recommend, that you don't eat all at once. So you just, take a sip and just eat something and then, walk back
Yeah,
with positive attitude. So this was
yeah,
really important for people to know,
yeah,
because sometimes people think, oh, since I'm doing well, let me, just, kind of drag this whole 2 or 3 blocks together, which is, I think, doesn't do well, because the concentration limit is also, not that great for us. So yeah,
yeah,
okay. So that
yeah.
is a good point.
I just
Uh,
had a silly tip.
okay, bring it on.
Su Super silly. People are gonna judge me after this, but
No, I'm
do
sure
I
they won't.
care? No,
No.
because I'm done with the exam.
Yeah, I know.
So the tip is that I super silly, but I used to carry a toothpick box just in case, like I had protein bars. And I'm somebody like sometimes the food wants to get stuck in the wrong time, wrong place. And then you don't want to be, getting like all the
Like
attention
your
goes to,
concentration. Yeah,
yeah,
that's
yeah,
true.
while you
Yeah.
are sitting in the exam and then you are like, so
Yeah.
if you are somebody who likes to eat or like to have a protein bar or whatever, somebody who likes to eat, and it's 8 hours long exam, so you might
Right.
want to keep munching something
Right.
during the
Right.
day. I advise to carry a toothpick
Oh my God,
box.
this might come handy, especially to people who are eating, protein bars.
Yeah,
So
you just
like
never know.
talking about that, like what things did you take as, supplements? Like did you take anything like to eat apart from the bars or something like?
I definitely like chocolate, which
Mhm.
not recommended because a lot of sugar and stuff. But after after a couple of blocks, you are done. Like you are done with 4 or 5 blocks, and sometimes you want to have it like for good mood, good energy, that want to
Right,
reward
right,
yourself or something like that. Small
right.
chunk is not going to do
Mhm.
any harm.
No,
So
yeah, true.
I definitely had
Hmm.
one small piece of chocolate. I had an apple, some protein bars. Also had a sandwich for the big 1 hour break. Never had it in the pressure, but I like to carry a lot of food. You will never
Nice.
see me
Yeah.
without food, and
Yeah.
some mint and chewing gums.
The,
Yeah.
okay, okay. Yeah, even that is good. So, in like talking about this, we should also bring out the point that every time you go out and go in the test center, so they will do a checking. So, accordingly, you should dress up and do not wear like extra jewelry or some things that might kind of, take more time in checking, because that time is from the break.
Yeah.
So, we
Yeah.
shouldn't like kind of waste our time during that. Okay, so now the most important question is about the mindset and mental health during exams. So, how did you manage your stress during the burnout period, if there was any?
All right, so I was super stressed during the step one preparation when I did not know much about USMLEs and everything. But I think during step two, I was more prepared. At least I was more sorted with the resources. Now I knew where to look for, like, okay, now there are study partners. So beforehand, I started looking for study partners. I started studying with somebody. That definitely helped me ease out a lot of stress. Plus, while you are doing a rotation in the US, you are already surrounded by a lot of people who are doing USMLE, and kind of
Right,
being in that kind of community and where people are also in the same journey. That also helps a lot with the mindset that, like, basically not feeling alone. So there was
right.
not a lot of burnout, I would say. I was a little burned out by the end of the 3 4 months where I felt like I want to give the exam, but then I was feeling stuck in the preparation in the final phase
Mhm.
where I wanted to do a quick revision, and that's when I decided to start the tutoring thing, and that helped me and kept me motivated. Like talking every day to people from different walks of life, and people juggling so many things. Like you said, I had so many students who have been like mothers or from different countries doing so many different jobs and stuff. So that definitely helps and takes away all the attention from just yourself and that burnout thing, like looking
Right,
things
right.
at in bigger picture.
Yeah, no, that's so true. Like sometimes we are too immersed in the current reality that we forget to kind of zoom out. Like this is not the life or the goal. This is just one phase and things will get better, but sometimes that phase kind of extends so much that we forget, the bigger goal. So yeah, it's so important to remind ourselves. So I mean, thank you so much. It was such a lovely insight. One last question that I have for you is, if one thing that you would do differently in your preparation overall for step one, step two, step three, be it mindset, resources, or time management, any one tip that you would do kind of differently, or a thing that you would advise to, upcoming residents. So what would that be?
Something for IMGs, something that I think I should have done way earlier in my journey was not just focus on giving exams and studying. While you are doing a rotation, be more focused on building those connections. Building connections is so important. It's not just about the scores and about doing just one thing. Try to make a holistic CV, try to build more connections, try to go to conferences, um, and just being present where you are rather than just
Mhm.
being stuck to the books. So that is one thing that I would definitely change in my journey and start a little early on. Rest, I feel, I think everybody's just gonna make it. It is just about time, and yeah.
Wow, okay. I mean, yeah, that is actually nice because sometimes we don't think about the other things and we just focus on, even for 1 years, 2 years, some people actually prepare for so long and they forget that there are so many other aspects in the CV that they would see, because once you sit in the interview, they don't care what your scores were, but they care like how you are as a person and what other things have you done in life. So yeah, very good point. And with that, thank you so much, Brinda. We will definitely do a part two of this video because I have so many more questions. But thank you so much, and it was amazing to talk to you.
Thank you. Same here. Would love to. Thank you for having me.